There are lots of questions a female patient should ask their doctor. The doctor himself should be concerned about symptoms such as chest pain, shortness of breath, exercise-related symptoms. Women's symptoms are somewhat different than men, so she needs to be very in tune to that. Shortness of breath, fatigue, exercise intolerance, dizziness or fainting are other symptoms that we would be concerned about. More importantly, we would also ask patients concerning risk factors that are associated with heart disease. Things like a family history of heart disease. If you have an immediate uncle or parent that has heart disease under the age of 55, if you have a history of hypertension, if you have diabetes, if you have a history of tobacco use. Knowing what your cholesterol level is very important, and more specifically, knowing what your HDL is, what your LDL is. And in women, things like triglycerides start to become important. Inflammatory tests are now out to assess whether or not there's inflammatory disease happening. Sometimes measuring CRP is becoming a little bit more important. So there are some things that a patient needs to know about themselves when they talk to a doctor, and there's some very important symptoms that they need to present to their physician in terms of making the diagnosis of heart disease.